What's going on, guys? Today we're going to be talking about aminos, what they do, and their bioavailability orally versus injectably. First one we're going to talk about is L-carnitine. It's great for fat metabolism, it's going to be great for exercise performance, and it's going to be great for recovery. So orally, its bioavailability is going to be about 5 to 15%, whereas injectably it's 80 to 100%. So orally, it's going to have a half-life of about 2 to 4 hours, depending. Whereas injectably, it's going to have about the same amount of half-life. The only difference is that it's going to have peak plasma serum levels sooner. Next, we're going to talk about dosing protocols for L-carnitine. First thing I'm going to do is go over it orally. So orally, it's going to be 500 milligrams to 2,000 milligrams a day, split up into 2 doses, normally morning and afternoon, just for general health. Now, for fat loss, it's going to be 2,000 to 3,000 milligrams a day, split up between meals that contain a lot of carbs to enhance absorption. But injectably, you're going to want somewhere between 200 and 500 milligrams done intramuscularly or subcutaneously 2 to 3 times per week as prescribed to help with athletic performance and fat loss. Something to keep in mind is that these higher doses done orally with L-carnitine might give you some gastrointestinal distress just because it doesn't really agree with you that much when you're pumping yourself full of 7 or 8 pills at a time. Next thing we're going to go over is L-arginine. Now what L-arginine is going to do is it's going to increase your blood flow, which is going to increase your nitric oxide production. With that enhanced blood flow, it's also going to help with your cardiovascular support because you have better circulation. Now, it's also going to help you reduce fatigue whenever you're exercising because of that extra oxygen that's getting carried into the tissues. Then it's also going to help with wound healing, it's going to help with immune function, and possibly erectile dysfunction because it may improve symptoms by enhancing that blood flow to the penile tissues. So, it's bioavailability, right? Orally, it's going to have about 40 to 70% bioavailability, whereas injectably, it's going to have 90 to 100% bioavailability. Now, orally and injectably, it's going to have a half-life of about 1 to 2 hours. L-arginine dosing protocols. So orally, there's a few different doses, right? For general health, you're going to want to do it for 3 to 6 grams a day, split up into 2 separate doses to minimize the side effects. Whereas for cardiovascular health and exercise performance, 6 to 9 grams a day, split up either between 2 and 3 doses for cardiovascular health or into 30 to 60 minutes before your workout if you're using it for exercise performance. Now for erectile dysfunction, you're going to want to take about 5 grams daily. Now for the injectable L-arginine, you're going to want to take 2 to 5 grams intramuscularly before exercise. Key consideration with L-arginine, the biggest one is going to be using it synergistically with citrulline. So combining L-arginine with L-citrulline is going to increase nitric oxide production and it's going to improve the bioavailability of the L-arginine itself. Now, some other important things to consider with this are going to be the contraindications, and that's going to be stuff like avoiding conditions like herpes or a herpes outbreak and using L-arginine because it's going to enhance the growth of the virus or potentially could. Also, if you're on any kind of blood pressure medications or anything like that, this probably isn't something you should be using. Next one we're going to talk about is going to be L-ornithine. So L-ornithine is going to be good for ammonia detoxification. If for some reason you have a lot of that in your system, it's going to work great for growth hormone stimulation, especially if you use it in conjunction with L-arginine pre-workout. And it's going to enhance your sleep. Now, some more downstream effects of that ammonia detoxification is that it's going to help with your exercise recovery because of that ammonia detoxification, but it's also going to enhance the nitrogen balance in your body. And then finally, it's really going to help with your liver health because it's going to support health with your liver and may benefit the individuals with compromised liver functions. And now everyone's favorite, the bioavailability of L-ornithine, right? So orally, it's going to have a bioavailability of 40 to 60%, whereas injectably, it's 90 to 100%. Half-life for both oral and injectable is going to be about 1 to 2 hours. L-ornithine dosing protocols. So orally what you're going to want to do is for general health, take it 1 to 2 grams daily, usually often before bed to help with sleep support. For exercise recovery, 2 to 6 grams daily, split into 2 doses, 1 pre-workout, 1 post-workout. And then for liver support, 6 to 10 grams daily divided into 2 to 3 doses. Now for athletic performance, you're going to do 2 to 5 grams pre or post-workout. So some key considerations that you're going to want to have whenever it comes to L-ornithine is combining it with L-arginine to synergistically stimulate more growth hormone during your workouts or after your workouts. Another one is going to be your timing. So take it either before bed if you're trying to get the sleep benefits or post-workout if you're trying to get the recovery benefits from it. And then side effects, high doses of the oral might cause mild gastrointestinal discomfort such as bloating and diarrhea. Glutathione. So glutathione is going to be good for a lot of things, like antioxidant protection. It's going to neutralize free radicals and reduce the oxidative stress in your body. Detoxification is going to support your liver function by aiding the breakdown and elimination of toxins, heavy metals, and metabolic waste. And then skin health. It may lighten your skin by inhibiting melanin production and reducing pigmentation if you want to be as pale as me. Now, some more stuff that is going to be really good for is your immune support. It's going to enhance immune cell activity and protects against infections. Cellular repair is another one. It's going to protect cells from damage caused by toxins and oxidative stress because it's going to lower your oxidative stress. And then anti-aging maintains mitochondrial health and reduces markers of aging. Now this one's going to be fun. Oral versus injectable. Orally, its bioavailability is going to be 10 to 20%, whereas injectably, it's going to be about 90 to 100%. So its half-life orally is going to be about 10 to 30 minutes, and it dissipates rather quickly, whereas the injectable form is going to achieve immediate high plasma levels, but the effects dissipate unless continuously replenished. Glutathione dosing protocols. So orally, for general health and antioxidants, we're going to take 250 to 1,000 milligrams daily, often combined with vitamin C to enhance its absorption. For skin lightening, 500 milligrams to 2,000 milligrams daily, taken consistently for several months. Now, injectably, what you're going to want to do is for skin lightening, 600 to 1,200 milligrams intravenously, 1 to 2 times per week, often combined with vitamin C. For detoxification medical therapy, 1,000 to 2,000 milligrams IV as needed or as prescribed. And then for athletic recovery or chronic conditions, 600 to 1,200 milligrams intramuscularly or intravenously 1 to 3 times per week. So some key considerations with the glutathione is going to be a combination with vitamin C is going to enhance the glutathione's effects and stability. Liposomal glutathione is a more bioavailable oral form that improves absorption. Precursor supplements like N-acetylcysteine, NAC, or alpha-lipoic acid may support endogenous glutathione production. Side effects rare but may include bloating, mild nausea, or injection site discomfort. Choline. So choline is going to be great for your brain and cognitive health. It's going to support acetylcholine production, improving memory, focus, and learning. Liver function is going to prevent fat accumulation on the liver by aiding in fat metabolism. And then nervous system support is going to enhance the nerve signaling and muscle control in the acetylcholine. Methylation and DNA synthesis acts as a methyl donor, supporting the homocysteine metabolism and DNA repair. Fetal development, crucial during pregnancy and for brain and spinal development in the fetus. So orally, it's going to have a bioavailability of 50 to 90%, which is the best we've been over so far. And then injectably, it's going to have almost 100% bioavailability. So for choline, the half-life is going to be approximately 6 hours for both oral and injectable. Now we're going to have different forms of choline for oral use. Choline beta-tartrate is going to be common, affordable, but it's going to have a lower bioavailability for brain uptake. Whereas alpha-GPC, glycerylphosphocholine, high bioavailability, effective for cognitive enhancement. And then citicoline, CDP choline, excellent for brain health and acetylcholine synthesis. Choline dosing protocols. So for general health, you're going to be using choline orally 250 to 500 milligrams daily. For cognitive support, you use 500 milligrams to 1,200 milligrams daily, often using alpha-GPC or citicoline. For liver health, 500 to 1,000 milligrams daily, typically as choline beta-tartrate. During pregnancy, 450 to 1,000 milligrams daily as recommended by a healthcare provider. Injectable dosing protocols are going to be for liver support, 500 to 1,000 milligrams intramuscularly or intravenously, 2 to 3 times per week for fatty liver or detoxification. Cognitive enhancement or acute treatment, 500 to 1,000 milligrams intravenously, 1 to 2 times per week under medical supervision. So some key things to consider with choline is going to be combining it with other nutrients. So it's going to work really synergistically with your omega-3s, with your B vitamins, and especially with the cognitive and prenatal health. Most importantly, though, side effects at really high doses, so north of 3,500 milligrams a day, might cause a fishy body odor, sweating, or gastrointestinal upset. And then, of course, your alpha-GPC and your citicoline are going to be better for the neurological effects that you're looking for. And then some counterindications, if you have certain liver disorders, maybe super high doses should not be something you consider. Carnosine. So carnosine is going to be great for antioxidant protection. It's going to neutralize free radicals and reduce its oxidative damage in tissues, which is beneficial for aging and disease prevention. It's also going to have anti-aging effects, which slows down the formation of advanced glycation end products, so AGEs, which are implicated in aging and chronic diseases. Muscle health and performance helps buffer lactic acid buildup during intense exercise, improving performance and reducing muscle fatigue. For brain health, it's going to protect neurons from oxidative damage and supports cognitive function, possibly delaying neurodegenerative diseases. Cellular repair aids in protection and repair and reduces damage in the cellular structures, especially in muscles and tissue exposed to stress and inflammation. Anti-inflammatory. It's going to exhibit anti-inflammatory effects that may benefit conditions involving chronic inflammation. So for carnosine, your bioavailability for the oral version is going to be about 30 to 50%, whereas the injectable is, of course, going to be about 90 to 100% bioavailability. Oral and injectable carnosine are going to have the same half-life, roughly about 1 to 2 hours. Carnosine dosing protocols. So orally for general antioxidant and anti-aging, 500 to 1,000 milligrams daily, often taken in divided doses. Exercise performance can be 1,000 to 2,000 milligrams daily, taken 30 minutes before exercise. For neuroprotective and cognitive support, it's going to be 500 to 1,000 milligrams daily. Now for injectable carnosine, it's going to be 500 to 1,000 milligrams intramuscularly or intravenously for athletic performance or recovery. And then for medical use, neurodegenerative conditions, things of that nature, 500 to 1,000 milligrams intravenously or intramuscularly 1 to 3 times per week under supervision. So, and then some key considerations with carnosine is going to be formulations. Some carnosine products are available in liposomal form, which may improve absorption, especially for oral use. Combination with beta-alanine. Beta-alanine supplementation increases muscle carnosine levels, which may improve exercise performance even more. Side effects at high doses may cause gastrointestinal discomfort, such as bloating or diarrhea. And then contraindications. Consult with a healthcare provider if you have any kidney or liver conditions, as they may be limited to research on the safety of these supplements for you particularly. All right, and then that's the rundown on a handful of aminos and over-the-counter supplements and their bioavailability orally versus injectably. Hopefully this helped you. Hope you learned something. Don't forget to like and subscribe.